Unshelling Medicine Podcast. Healthcare in the language we understand.
Good morning, everybody. Welcome to another episode here on Unshelling Medicine. So I have the pleasure of having Dr. Isabelle Amigues with us. Dr. Isabelle is a rheumatologist. We're going to talk about her practice, what she does, the education she can provide today. So it is going to be useful for not only people who may be diagnosed with the disease or a disorder, their family members, loved ones, or generally whoever is curious to learn more. So pull up a chair. It's going to be a great discussion. So welcome back. Hi, Dr. Isabelle. How are you?
I'm very good. Thank you so much for having me, Idongesit. It's such a pleasure to be here.
Pleasure meeting you as well. So when we're talking about rheumatology, what is that?
Such a good question. It's like probably if you ask this to every, like a 40 rheumatologist in a room, you have 40 different answers. I like to say it's the science of inflammation. It's the science of systemic autoimmune disorder, but also inflammatory disorders. And the way I like to describe it is that it's Dr. House without the attitude, or with a different attitude. But it's like Dr. House. It's like figuring out the pieces together, figuring out what's going on. And it's really not just one organ. It's the full body. It's really understanding how the full body is working.
So when we talk about inflammatory processes in the body, people could actually naturally say, well, I'm not doing anything to cause inflammation in my body. So why is there inflammation in my body? And how would you answer that as a rheumatologist?
Oh, that's just a good question. Thank you for asking this. So actually, inflammation is the way our body heals. So if you actually think about it, I think it's 8 minutes or 8 seconds. I think it's 8 minutes, but every 8 something, there is a cancer cell that is being made in our body. And our body is very well done, which means that it's going to actually recognize it as not something that should be around. And so it's actually going to create inflammation and get rid of it. So the process of inflammation is how we heal. When we have an infection, same thing. We heal from the infection by causing inflammation. The inflammation gets rid of the virus or the bacteria, and we heal from that. What is an issue is when you have inflammation that kind of like creates its own issue, meaning that it is too much in comparison to what it does to your body. So, and I don't know if you remember that, but like when COVID-19 started, there were young people who had no reason to have severe infection. And yet they did, and some of them actually died of this. And they died of very severe inflammatory response. It's because their body, some of them at least, right? Like it's a little bit more complex than that, but some of them, their body would recognize, their immune system would recognize COVID-19 as something that they had to destroy at all costs, to the point that the inflammation kind of took over and actually shut the different organs in the body. So there is a fine balance in our inflammatory response where you have to have an inflammatory response. That's super important, but it cannot be too much. And when it's too much, it can cause severe issues. And when it's too much, it can basically not allow the proper inflammatory response to work, right? So, for example, we know that cancer can be a problem of inflammation. And in fact, nowadays we are treating cancers by stimulating our immune system because we need that response. And in rheumatology, it's kind of the opposite. You have to calm down the immune system because there's too much inflammation. Don't know if that responds to you, but so yeah, it's a normal that can become abnormal process. And the other thing that, and I think this is what you were kind of like asking under, between the line, which is like, there is like inflammation that is not good that we do on a regular basis. So for example, if we eat processed food, we know that it's very linked to inflammatory issues. And I'm talking cancer, rheumatologic disorders, to begin with cardiovascular disorders, right? And in fact, actually, the more you actually dig into the studies, the more you realize that all of this is an inflammatory issue. It's not that the inflammation is bad. It's just that in those cases, we know that there is inflammation that's causing the cardiovascular issue, that's causing the cancer, that's causing the rheumatologic disorders. So processed food is a huge one, very well studied. And I'm just going to share this because, it's funny. I'm a physician, but I'm also a person. And what I know as a physician, when I put my hat as a physician, is actually a little different than when I have my hat as a patient. And this is really interesting. Unless someone tells you what processed food is, you don't necessarily understand. What is processed food? It's literally anything that's packaged. So anything that's not in the produce section is actually considered processed, which was a mind-blowing realization as a patient for me, because yes, I knew what we meant when we said, don't eat processed food. And I would say that to my patients when I was a medical student. But really, when you realize, you're like, no, but like literally everything is processed. The only thing that's not processed are the produces. And, if you eat some fish or even like maybe some meat that are very, very lean and not processed, but like a lot of things are processed, even in the meat department or in the fish department, right? And so processed food is a big one. Second one is being overweight. We know that the adipose tissue causes inflammation. And this is actually such a cool thing for us to realize, is that, with all of those new drugs like the Ozempic and Wegovy and all of those different drugs, we are seeing that there's an anti-inflammatory effect by itself that can help rheumatologic condition. So to me, it's fascinating, and it's really, exciting as a rheumatologist to think that we're not using necessarily those drugs to just lose weight. That's not just the issue. It's literally we can decrease inflammation to a degree that just the weight loss doesn't explain. So to me, that's really exciting. And then stress can cause inflammation, poor sleep. And I was just talking about sleep I do a live on YouTube, like it's called Rheumatology 101 by Dr. Isabelle Amigues. But I love doing this because I love educating like you do, Idongesit. And I was just sharing how sleep is related to autoimmune disorder and how it's like a vicious circuit, because autoimmune disorder can cause poor sleep can cause flare, and so on. But yeah, poor sleep, either quality or quantity, can cause inflammation. And actually, it's not that it causes inflammation, is that when you're sleeping, you heal of this inflammation that's needed. If you don't sleep, or if you don't sleep well, you're not allowing your body to heal. And so because you're not allowing your body to heal, then ultimately there is this inflammation that's just ongoing and that can take its life on its own. So not the greatest. But yeah, and stress, definitely, that's a huge one. We all know it. When we're stressed, when we're like scared or angry, all of those feelings, right? You have to go through them, journal it, because that actually will make you feel better instead of leaving them, because that actually causes inflammation, because that is it's normal. It's a sort of a flight or fight reaction when you do that. Yeah. And then being sedentary, that's not great either, because exercise allows us to have a good inflammation. So you're actually creating inflammation. So then your immune system can heal. So it's kind of like teaching your immune system, hey, we need you to know how to work. And so you need that, right? So that you can heal. So those are like the couple of little things that are, definitely causing inflammation on a regular basis, and how we can make sure that we heal our bodies, right? And that's important, our bodies and our mind.
Yeah, absolutely. So, you said a number of key points that either people realize it or do not realize it, but sometimes is difficult to control. The diet aspect, right? Culturally, there's some people that, when you talk about anything that is not in the produce section is processed, right? And then when you think about the pastas of the world, you think about the noodles of the world, you think about the processed white rices of the world, or white rice, I should say. I don't think rice has plural. That's English. Yes. White rice of the world.
I guess it depends. There's so many of them.
We have jasmine rice, we have Uncle Ben's, we have the parboil, we have, you name it, right? All the brands. So when it comes to diet, people do struggle, right? So if I grew up eating this all my life and that is what I'm used to, okay, and is a staple in my cultural diet. You and I just talked about the African culture, the African continent, and also the Nigerian culture. Rice is a staple in our diet, right? The same way rice is a staple in most Asian culture, right? So growing up eating food or different dishes that are made with rice, how do I mitigate or, kind of, because I'm not a fan of elimination diet.
Yeah,
It doesn't work long term. It just does
I
not.
agree.
But, how do I basically cut back on how much I eat? I think that is where people gets lost. So when we come to the realization that, oh my goodness, the foods that I'm used to culturally could be contributing to this disease process. Now, how do I live a healthier life? How do
Yeah.
I, cut back? That is where
Yeah.
people struggle, Dr.
And
Isabel.
And I love this question because I struggle with it. And I was telling you earlier that I had been a patient and I am still a patient since I had to deal with stage 4 breast cancer that was metastatic to the liver, to the bone. So that was scary. And 3 different people, when I just got diagnosed, told me from 3 different areas of my life, including one steward on an airplane, diet, change your diet. And I was like, universe, I hear you. 3 different people, that's it. I don't want to change my diet. That's not something that I want to do, but like 3 different people from different, at one point you're like, okay, I'm listening. And the truth is that you all know, like we know that it's important. So one, I hate the word diet, not hate, but I don't like the word diet because it means restriction. There is, and that's what the steward said. Oh man, I need to share the story so that you're going to understand how I think about it. So I had been diagnosed and it was funny, just after my 40th birthday. And I had planned a trip to France for my 40th birthday because I was in a horrible mind. I was doing my midlife crisis and I was not doing well. And I was like, I need to go to France and be with my friends. And so I had planned this trip. I just 2 days before I think it was the day before the trip or the day of, I get my biopsy to this big, huge mass on the breast. and I'm laughing because I was like kind of hoping that it wasn't what it was. But I was like, it could be this and that and this and that, like differential diagnosis when really like it's pretty obvious. And I took the plane and then I stayed only like 3 days. It's refilled my soul. The power of love is really huge. And we have to remember that. And come back to France and I learned of the diagnosis at this point. When I was in France, I was on the phone, learned about the diagnosis, and it was indeed breast cancer. And at that point, we knew that it was at least stage 3 because it had at least involved the lymph nodes. And so I was in this, kind of like this mindset of like, but what's so fascinating to me is, and so wonderful at the same time, is that it's in those moments where you're vulnerable that life can bring so much good. And so I was not doing really well, but I was just open. I don't know how to explain this. And I was getting some water in the plane and it's a 10-hour or 9-hour flight. And somehow I'm talking to the steward, and because it had just been given to me, I think I talked to him about this diagnosis. And he tells me, change your diet. My mom has had brain cancer for many, many years, and she changed her diet, and she's doing actually pretty well. Have you considered changing your diet? And I was like, well, I really don't like the idea of restricting myself, especially with this diagnosis. It's kind of like, it's already stressful. And he's like, no, it's not about what you cannot eat. It's about what you can eat, what you want to eat, what you choose to eat. And that was the first thing. And then I started going to the grocery shop and being like, what can I eat? What do I want to try? What do I want to put in my body? So when I go to the shop, I'm not telling myself this is not for me, which by the way works for some people. It does work, right? When you're like, this is not for me. And I have said that to myself when I'm, at a party, I'll be like, this is not for me. And basically, yeah, so I'm going to to the grocery shop, and I'll stay longer, and I'll make myself stay longer in the produce section because this is where I want to be. For me, this is a choice. And so it's like, I'm French, dairy bread, huge, wine, dairy bread. Those three things, that's the staple of my life. Like I used to eat pasta, bread, dairy. That's all, right? And I couldn't understand. And I was like, well, I'm going to continue to eat dairy. Why not, right? And then someone is like, well, do you really want to put growth hormone into your body? And I'm like, wow, you just have to explain this because now I'm looking at dairy and I'm like, not for me. Like, I don't want that in my body. And so I think that this is the role of a physician. This is a role of healthcare practitioners of explaining. It's not like, don't do this. It's like, hold on. We know that processed food actually causes inflammatory arthritis. How much medication do you want, or how much power do you want to have in your life, right? And then how can we change what you eat so that you don't feel restricted? If you want, look, at the beginning, I continued to eat 2 pieces of bread per day. And then it became to 1. And then I actually changed it to injera, which is that bread that can be gluten-free, Ethiopian bread. And I love it, right? So I would put the injera, put a ton of veggies on top, olive oil, drizzle with balsamic vinegar. And I had this most beautiful plate. And I never felt restricted because I felt like this is amazing. I love it. Like I'm not restricting myself at all. So it's this, if you really like rice, if this is the staple, do the rice. The question is, can you start eating the things that are on the side of the rice that are making most of that plate? And whether it's spinach, whether it's, I don't know, like onions, garlic, bok choy, I discovered veggies during this time. Like I have to thank this history of cancer for making me discover sunchoke, bok choy, like so many veggies. Like it's actually pretty remarkable. Turnips. I had never had turnips in my life before. So, right, like it's kind of this cool thing of changing your mindset. But yeah, absolutely. Eat the rice if this is your staple. Like no one, like restricting yourself is going to cause stress. And so it's going to cause inflammation. That's not what we want. And if you're invited, and I say this to everyone, if you're invited at a big party, you're not going to have your little plate and not feeling, no, but put all the things that you want for your body, and then put the things like, I like 80%. Like aim, like go for 80%. Mm-hmm. You have 20% leeway. That's actually a lot. To leeway of 20%, you can do a lot. So yeah, my long answer to your question.
No, that was a great long answer, a much needed long answer to that question, because it can be challenging. Like you said, it can be a source of stress. So as opposed to abstinence or complete elimination, teaching people how to substitute, even with rice, if you must have like a greeny kind of texture with whatever sides or what are you eating with, you can substitute with something healthier like barley. Barley is a little more healthier than, the processed white grain rice. But, over time, when you start maybe reducing portions, like you said, you get to a place where you can do without it and substitute it with something healthier. So how did you, as a French woman, how did you deal with wine?
Oh, I cut it. It's funny how the body can adjust really well. Mm. Yeah, I think I was drinking quite a bit at the time. Not a lot, but I was drinking on a regular basis, like maybe like 4 or 5 times a week. And it was like, just one glass of wine. It didn't have to be a lot. And yeah, I cut it. I cut it completely because it's sugar. And I didn't want sugar because cancer cells love sugar. Yeah. And I think, for my patients with rheumatologic disorders, like sugar is the most processed food of all. It is highly processed. It's not a different category. It's not like there's sugar and processed food. It's like sugar is the most processed food of all. And yeah, and I stopped it completely. It wasn't the hardest to quit. I think the hardest to quit for me was milk and dairy, because that's basically was my food. And that's why it took me like to actually understand why stop it. And it's when someone said, do you really want growth hormone? And I was like, oh, no, 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 no. I don't want that. I do not want that. Again, I will say I eat like once there was remission and it's been a while. I eat a little bit more dairy now, but I try, like, it's not something that I do daily at all. I don't drink milk at all. And I used to drink so much milk. So yeah, I think it's just a matter of telling yourself, I'm going to like, do I really want this? Like, what do I want in my life? It's kind of like the smokers, right? I love helping people quit smoking because I do it a very different way than the vast majority of physicians do it. Physicians are like, you need to quit smoking. And they're like, yeah, well, great. I used to smoke. I know how great it is. And it was a lovely thing that I used to love to do. And that is not how you're going to get your patients to quit. But if you actually say, look, there's a reason why you're smoking. It's wonderful. It's something that you love. It makes you feel good. Think of all of the reasons why you love smoking. Right. So because most of the people are like, I hate this thing. And I'm like, yeah, you hate it. Okay, sure. But, and they're like, and I cannot quit. Okay, sure. You hate it. But what do you actually like about it? Because it's only the day that you realize what you're liking from it that you can actually quit that, because you can recognize what you're going to miss and you can then have a way to fix that. So for me, like realizing, like one of the things that I realized is that I loved the taste that it added, right? Like cheese added, but what did it add? It added a little bit of salt. So then I just put some grains. I put like, cashew and almonds, and that gave me this extra pop on my salad, right? That was the cheese. I realized that if I didn't eat bread, I wouldn't want any sort of milky stuff. So that was okay. And then for my coffee, I realized that I was totally okay with just oat milk. So, right, like it's like, what did I like? I liked my coffee. I like, all of those things. And then, and then sugar, you realize that you have to quit. And then after a week, you actually don't want sugar as much. It's actually fascinating. Yeah.
Yeah. That is so, your take on education is very, very empathetic. That's the word that is coming to mind, because people don't respond to the finger wagging.
No one.
Naturally, naturally is offensive, and naturally is judgmental as well. So the one question that I would ask, out of the areas, so many different areas of medicine, why was rheumatology attractive to you?
It's the best. That's why. I'll tell you why. So I did 2 trainings, right? I did one in France and then I did one in the US. So one in Paris, then I did my residency in Lyon, fellowship, because it's kind of like combined. And then I moved to the US and I did a lot of research. And then I was at Columbia University where I did my fellowship, and I could have chosen anything. Like, right? Because you have this opportunity of choosing a second specialty. I knew that it had to be medicine because I really love it, but I could have chosen any other specialty. And I was like, and people were like, what are you going to do? Do you want to? And I was like, no, rheumatology is like the best specialty on earth, right? And it's for 3 reasons. I mean, there's many other reasons, but the 3 main. Number 1, is intellectually incredibly satisfying. Like when I said I'm Dr. House without the attitude, I really mean it. It's like people come, they've seen 10 different doctors, and I figure out what they have. I mean, it's not, well, I guess in this case it's me, but you know what I mean? Like we figure out what they have. And I've made diagnosis of Lyme disease, syphilis, diabetes in the past 6 months, where the patients come with something that looks like rheumatologic disorder with joint pain. And then you're like, bam, this is what this is, after just like talking and listening to the patient a lot. So super intellectually satisfying. The second is that the type of patient are wonderful, and it's a chronic, very often there are chronic conditions. So you're not doing emergency medicine, which is kind of like, for me, emergency medicine is kind of like a chocolate box where every time you pick something, you don't know what you're going to get, but it's very short. A chocolate is very short. So emergency medicine is kind of cool, but it's like you don't have this continuation of enjoying the present that's given to you with that patient, right? So a chronic, when you have rheumatoid arthritis, my goal is full remission for the patient. Our goal is full remission. And we get that. We absolutely get there. And then it's kind of a lifelong journey of helping our patients to have a total normal life where there is no flare, where they don't even remember that they have a rheumatologic disorder until they have an appointment with me, or, they are taking their medicine, maybe. That's it, right? So I love the patients. And then the third one is that, because I think oncology is very interesting, like cancerology is very interesting. I think that infectious disease is very interesting. The one thing I love about rheumatology is that the treatments are so powerful and work so well. And so for me, it's this idea that not only is it an interesting field, not only are the patients amazing, and I get to create this connection with patients that can literally last a lifetime, and I get to actually have tools that allow me, I mean, it's not me, but allow us, because it's never me, it's us, allow us to put them in a place where they don't have to worry about the condition that are seeing me for. Does that make sense? So yeah, in a nutshell, and there's so many other reasons.
I mean, it takes somebody that has a vigor to learn and find, like, figure things out to do it. And you clearly have a passion for it. You clearly have a love for helping people, and that is very admirable. So I know you mentioned that you also host a YouTube live where you do your education as well. So in addition to that, just let our listening audience know where they can find you and continue to follow to learn from you. And, should anybody be interested in reaching out and working with you, what that process looks like.
Absolutely, yeah. And so because of this history of my own health that I'm going to call crisis, because it's a choice. Well, I don't know if it's a choice. That would be a bigger discussion. But my own health crisis, and healing, I think that's what's the most important. Because of my own health healing, when after COVID, basically, I realized that I couldn't stay in the system that I was in. And I opened a direct care practice where basically, yes, I work with insurance to get my patients the medications they need and so on. And I work with patients directly, so they pay me. So we have this relationship like we used to have 50, 70 years ago, right? Where the patient paid the doctor, like it was normal. And it's kind of like this relationship that is so important, actually, right? And, either 2 visits to figure out what you have and give you a plan, or for a full year. And then hopefully you want to continue, and a lot of patients continue. But my goal in a year is to have you in full sustained remission. That's like really important. So it's called Unabridged MD. It's in Denver, Colorado. I see patients across the nation with telehealth, but it's nice to have them like in person, because that's huge, like how can help. Unabridged MD for the non-edited version of me for my patients, and the non-edited version of my patients so that they are seen as a whole. And I have a podcast called Unabridged MD. I have this Rheumatology 101 live to teach rheumatology, whereas the Unabridged MD is more like health and mindset. And actually, honestly, whatever interests me at that time. And that's very broad. There's no niche, I guess. I just love it. And it's kind of like this excuse to find really cool people to talk to. So I'm going to keep doing it. I love the conversation we have. And yeah, and that's Rheumatology 101 Live. And then on Instagram, I think TikTok, Facebook, it's Unabridged MD. And I would love for you guys to join. And it's, it's just this wonderful, wonderful way of educating people. That, to me, that's what's important.
Absolutely. That's beautiful. So we will make, in case you didn't catch everything, we'll make all of that available in the show notes. So you can just click in and find Dr. Isabelle. She's a fun and cool person to talk to. So I'm also eagerly waiting to get off so I can follow her YouTube page and set my alarm. So when she goes live, I'll be notified and I can jump in. Educating people just, there's a special joy that it carries. And It's always cool to find people who share that joy. It's obvious that you absolutely love doing this, and thank you. Thank you for not only practicing in the way that benefits the people that come to you, but actually enjoying it, because it shows and it makes somebody excited to learn from you. And for everybody who's listening to us, if you have searched for answers and you feel like, okay, you haven't gotten the answers that you need, go and check her out. Check her out, see what she's about, see if you can consult, and just go from there. All right. Thank you, everybody, for listening. Thank you, Dr. Isabelle, for being here. I know your schedule is packed, but thank you for making the time to
Thank
have
you.
us have this conversation and for educating our listeners.
And thank you for having me. I really appreciate it.
Thank you. So take care of yourself, everybody. Bye-bye.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.